Hi, I'm Marty Jolly, Director of Nursing from Dakota Abilities. I want to just take a little time to talk to you about pressure injuries. What causes a pressure injury? How do we deal with one if we suspect that it's there? And then what needs to be done to help it heal throughout the process once a pressure injury has occurred? The first thing to know is what causes a pressure injury. Anytime a person has a bony prominence on their body where blood flow is cut off to the tissue that surrounds that for too long, it can result in tissue death in that area. So, for example, in this situation, if this individual was lying on a bed and their elbow was down on the bed, and maybe that bed was decreasing the blood flow to the tissue below that elbow, if that went on for too long, what we would notice is that the tissue would start to turn red. That's an indication that blood flow has been impacted to that area. What I want to do at that point is, okay, if I'm repositioning that person and I notice that the elbow has become red, I want to move it and take the pressure off that area to see if in 15 minutes it's still red. So I can take something like a pillow and place that under it just to prevent that pressure and to help that blood flow through that area. 15 minutes later, I'm going to come back and I'm going to go to that site. And now I see that there's no more redness, so there is not a pressure injury that's occurred in this location. But let's go ahead and look at another example. In this example, if I came to look at this individual and I happened to turn them on their side and I noticed that the tissue was red along their side, and then I left for 15 minutes, I got the pressure off that area, and I came back 15 minutes later, and this is still red, then we know we've got a pressure injury that's occurred. Sometimes there can be more damage under the skin than we can even see on the surface. So indicators of a pressure injury can include pain. That person might be having pain at that location. They might have a fever that starts. That area could become really firm to the touch. It could become red around it. If it opens, there might be drainage that has a foul smell. Any of those things are signs and symptoms that we want to watch for. And if something like that is noted, we're going to want to do something right away to get pressure off that area to decrease the chance that it's going to get any worse. Examples of areas where a pressure injury can occur are anywhere where a bone is near the surface and comes into contact with the surface. Example would be if a person is lying in bed with their heel on the bed. That heel lying on the bed can become a pressure injury. If the person has their elbow on the bed or has their head lying in the same spot, the back of their head could become a pressure injury. Their shoulders in this position could. If that person was turned on their side, then the hip that they're lying on could have a pressure injury, or their ankle. They could, if laying on that side and pressure is impacting that ankle, they could get a pressure injury there as well. So what do we want to do if we notice in a situation where the skin has turned and it's red, like it is in our example here? So we've got a pressure injury. I come back 15 minutes later and it's still red. The key for this person is going to be offloading. We want to get that person off of that area where the pressure injury has occurred and keep them off it. So in this example, the pressure injury for this person is on their right side. If that is Jim, my mannequin here, and it was the right side where that pressure injury occurred, then I can have Jim on his back, or I can reposition him to his left side, but I'm going to avoid the right side. So then what I would do is I would reach out and ask a coworker to help me reposition him to make sure that we're positioning him onto his back or his left side. But for 2 weeks, at least 2 weeks, I want to keep him off the side where the pressure injury occurred. That's called offloading, is keeping pressure off of that area, and that's what's going to allow it to heal the quickest. We talked about offloading. Now let's talk about how do we do that for a person. If that person has that pressure injury and we've confirmed that that's what it is, we need to keep that person off that area that's injured for at least 2 weeks. So it's key for that individual that every 2 hours we reposition them and avoid the side with the pressure injury. So for Jim, his pressure injury is on the right side. So I'm going to reposition him between lying on his back or lying on his left side, but I'm not going to reposition him onto his right side. If a person has a pressure injury on their left side, I'm going to be repositioning them between their back and their right side. If the person has a pressure injury right on the middle of their back side, then in that scenario, we're going to go to the left side or the right side, but not have them lying directly on their back. So that's the process of offloading. It's just keeping pressure off of that area so the tissue can be fully perfused and regrowth can occur. Tissue regrowth is what we're looking for. In this situation, Jim is an individual who can't reposition himself. So every 2 hours, I'm going to be assisting him in repositioning. You're going to do that for every person you support that can't fully reposition themselves. Every 2 hours, you're going to get with that person and help them get moved into a comfortable position. I'm going to go ahead and have Jen assist me right now, and we're going to reposition Jim to keep pressure off of that side. So Jim's pressure injury is on the right side, nearest to me. So I'm going to have Jen help, and she's going to, using the chuck that's underneath Jim, she's going to pull him a little bit towards her. Okay, Jim, she's just going to pull you up a little. I'm placing a pillow under you. Go ahead and go back down. What we've done here is we have offloaded, made sure that there's no pressure on the right side. We also, previously, before we repositioned, there was pressure on the back side. Now we've moved that pressure to the left side. We've successfully offloaded for Jim. Thank you, Jen, for your help. 2 hours later, it's time to reposition Jim. I can just let him know, hey, Jim, I'm just going to take this pillow out and you can just lie on your back. And all I have to do is pull the pillow out from under the chuck, and he's now back on the back side and can remain like that for 2 hours, and then I'll reposition him again. Now that we've gone through offloading, what are the next steps? So we make sure we've notified the proper channels. If we need to notify a nurse that we've noticed a pressure injury, we're going to notify them. If the wound is getting worse, we're going to notify the nurse. If it looks like the wound is healed, we want to notify the nurse. In the situation where there's reports we're supposed to fill out, we're going to want to make sure and complete that report. So if we use therapy reports, we're going to want to do that medium medical therapy report on any communication about how that wound or that injury is looking for that individual. Now let's talk about, we've got a new pressure injury. We know that 15 minutes later, it's still red. There is for sure an injury. What can you do as a staff to help with that area right away besides offloading? Well, the next thing we can do, if we've got an injury like this where it's staying red, we know we've got a confirmed pressure injury. What can you do as a staff to help until a nurse is able to assess that area and come up with a treatment plan? The biggest thing that you can do right away is apply something over the top of it to help protect it from having more pressure applied to it or having more damage occur. In that scenario, any sort of gauze, or if not gauze, a foam type padding could be placed over the top. And you might have different types of foam padding that could go over the top. Or you might have a larger bandage that you could place over the top. Anything that's just going to help protect that site. In this situation, this isn't an open wound. There's no drainage. So I'm not trying to capture drainage. I'm just trying to protect the area and keep pressure from being applied. So I can go ahead and take something as simple as just gauze and a little bit of tape. I can secure it to the person over that pressure injury, and I can notify the nurse. And then the nurse, when they come to look at it, they can remove the gauze and get a look at the site. Okay, you're taking care of an individual where they've got a pressure injury and it's continued to the point where it's opened up, they've got drainage, they've definitely got pain at the site, we're worried about potential for infection. So we've gotten orders from the physician on how to care for it. The first thing we want to keep in mind whenever we're dealing with these injuries is we want to keep them clean, but cleansing needs to be gentle. We don't want to be too hard on the skin because we can actually damage the new tissue and the new growth that's happening. Before I take care of any wounds or do anything with a wound like this, I'm always going to perform hand hygiene. So I'm going to let Jim know, hey, I'm here, I'm going to take care of your wound, I'm going to complete the orders that we have. I'm going to go ahead and use my hand sanitizer, and I need to make sure and really rub that around vigorously on my hand for about 20 seconds to make sure it has time to clean all those surfaces. Once my hands are clean, next thing I'm going to do is I'm going to don my gloves. I want to protect myself from anything that I'm going to come into contact with. We know this is potentially infectious material that we're dealing with, and so we need to protect ourselves. and always be wearing that equipment. So I've got my gloves on, I've already washed my hands. Next thing I'm gonna do is I'm gonna get a look at the site. If it's covered, I'm gonna go ahead and take the dressing that's previously on it off. I'm gonna throw that in the garbage. And now I wanna cleanse the area. So I would have a warm washcloth with soap on it, and I'm just gonna gently cleanse the top of that area. I'm gonna start with the middle of the wound and then work my way outside. I don't want to start outside the wound and cleanse towards it, because then I'm going to bring bacteria from over here over to that open wound and potentially cause an infection. So always make sure that you start in the middle, and then you're just going to clean out from there very gently, not trying to damage any of the tissue. Once you've cleaned it well, then grab yourself a dry cloth and you're just going to pat it dry. You don't want to do any friction rubbing motion, because once again, that's going to damage that delicate new tissue as well. So we're just patting it dry. Once we've got it dry, now we can apply whatever treatment method we need to that the physician has ordered. In this situation, the physician has ordered an ointment that's going to go over the wound. When it comes to any ointment that you're going to apply, it's really important to read the directions on the tube for how that should be applied. And this one says to apply minimally. So I don't want to be using an excessive amount of this, because that's not required. So I can go ahead and put a minimal amount on my finger of this person's medication, or I could put this medication into a little cup and then take from the cup when I go into the person's room. I'm just going to put a little bit on my finger. And then I'm just spreading it around that site. I'm not spreading it around the outside. This ointment is specifically to help the wound heal, so I don't need it to be on the outside of the open area, just on the open area. So it's saying apply minimally on the open area. The next thing I need to do is apply the bandage that the physician has ordered. Because of the fact that this wound is one that's draining, we've got a bandage that has the ability to absorb that moisture, and it's got an adhesive edge so that the moisture doesn't go out beyond that to keep the surrounding skin intact. So I take the backing off of the bandage. It's just a peel away backing. Once I get that peeled away, you can see that I've got that foam that's gonna soak up any drainage that's coming from that site. I'm going at it kitty corner there to get the best coverage, and then I'm just gonna seal around the edges and get those sealed down very well all the way around. If there's an edge that I'm concerned about having enough stick, I can always take an extra piece of tape and put it along that edge to help secure that. When I was doing that process, I noticed that there's more drainage there than there was previously, and there's a slight smell to it. In that scenario, I'm going to go ahead and notify the nurse, because this wound is increasing if it's got an odor that it didn't have before that smells foul. So I would complete a GER, medium for medical, and state what I noticed about the wound, the foul smell, and I'd give the nurse a call to let them know, so that the next time they have a chance, they can check out the wound. Thank you for coming along on this training with us about pressure injuries.